Mr. Jones. My name is Tiffany, and I am the student nurse that is coming in here to work with you today. I'm going to put a curtain here for you. I'm going to be starting an IV on you because that's what the doctor ordered, in case you need some medication or any IV fluids or anything like that. Have you had one previously? And he says yes. I said okay. So you are familiar with the catheter being in place in the vein while the needle is withdrawn. So it's just that plastic catheter piece that's in the vein for that access. He says yes, okay. And you understand this procedure and you're able to follow commands? And he says he is. All right, do you have any allergies at all? Or any sensitivities? And he says no. Okay, I'm just gonna go ahead and check. Can you give me your full name and date of birth? And he is able to do so, and that matches. Okay, so I just checking, do you have any issues with me using this arm? I know you previously stated that you are right-handed, so the left hand would be a great choice here. There's no, you've not had any surgeries on this extremity or any, you don't have any dialysis consults or fistula to worry about. And he says no concerns. So we'll go ahead and use this left arm here. I went ahead and gathered my supplies to be available. I have my tourniquet, alcohol prep pads, I have my 20 gauge catheter, I have my extension set, I have my I have my 2x2 and my tape and my flush, as well as my dressing. All right, I'm going to go ahead and double check my order here. I have Bob Jones, and he denies allergies, which is correct according to his records. We have our order for our IV saline lock start, so that's all checked, and no allergies. Okay, great. So I'm going to go ahead and ready my my equipment. I see the vein here on this arm is very straight. I don't see any issues with the site, any bulging like valves or anything in place. Like I said, it's very straight, no wounds or injuries to the area. I'm going to go ahead and do my, I'm going to open my extension set. I'm going to place my cap there without touching the tip. I'm going to go ahead and take this out. My expiration date is within normal range here, and I'm going to go ahead and apply my flush, and I'm going to flush the site. I got the bubbles out of the saline syringe, so there's no air being introduced. I don't have any bubbles or any air to be concerned with, so I'm going to go ahead and just lightly twist this cap off. Put a little bit much in there. Okay. And I have my IV ready to go. All right. Put my gloves on. I can go ahead and place my tourniquet on. I want to do that 15 to 20 centimeters above my site. I don't want to leave it on longer than 2 minutes. I also want to check to make sure I still have a pulse, that it's not too tight. again, this looks really, the vein looks very well pronounced here, but I could have him squeeze his fist, or I could possibly, if needed, apply a warm compress to the area for about 15 minutes and then reassess here. So I have this all set, my IV's ready to go. I'm going to go ahead and clean the site in a circular motion, starting in the middle and moving outward. Okay, and I'm going to go ahead and let that dry. Okay, that's dry. Now I can go ahead and start my IV. So I'm going to pull down the vein taut here, and I'm going to go ahead and start at a 15 to 30 degree angle, and then I'm going to go ahead and that was bevel up. I'm going to go ahead and advance the catheter. After going in approximately another ½ centimeter, and then I can advance my catheter. I put my needle in the sharps. Go ahead and remove my cap. And then I can check to see patency, which it is patent. There's no burning or irritation, pain when I push any fluids in here, Mr. Jones, and he denies. I don't have any concern there. I'm just going to grab my 2x2 and clean that around the area, and then I can place my tegaderm here. Alright, this has been flushed and locked, so I can remove the flush. I'll go ahead and label the gauge, date and time, and my initials to let the next nurse know, or the physician, as to what is here and when it was placed. And then I'll go ahead and secure with additional tape to make sure that it doesn't come out. Alright. And just reassess the patient, make sure that there's no pain or anything like that, and he says no, so I can remove my equipment here. If he were really elderly, I would consider possibly using maybe a different means of securing the catheter to the skin, something that maybe like paper tape that would be a little bit more forgiving for that sensitive skin, or if this is a very young person that maybe a toddler who could very easily pull it out, I may have to secure it a different way, maybe using some Curlix or something that secures it really nicely without it being obstructing. And everything looks good here, so I would go ahead and I would take my equipment and my supplies. I would put those away. Obviously I put my needle in the sharps. I can go ahead and remove my gloves, wash my hands, and I would make sure that Mr. Jones is in a comfortable position with what position his head is in. I would make sure the bed is low to the ground. I would make sure the call light is within reach for him. And I would go ahead and document. I would document the gauge, date, time, how Mr. Jones responded to the IV, any adverse reactions or anything that would be significant that would need documentation. And I believe that's it. I would wash my hands and exit the room.